So next topic is gout and gouty arthritis. And the risk factor for gout, they include uh, meat and alcohol consumption, because meat can lead to excessive formation of uric acid. Tumor lysis syndrome, because in tumor lysis syndrome, when tumor cells are broken down, they release nucleic acids which are converted into uric acids and which can cause gout. So someone with a history of meat and high consumption of meat and alcohol, for example, businessmen who do excessive hoteling, they usually uh, have high consumption of meat and alcohol. Someone with a history of tumor lysis syndrome, someone with chronic kidney disease, because chronic kidney disease can lead to a decreased excretion of the uric acid, which can accumulate in the and result in the gouty arthritis. And the fourth risk factor for gout is the use of diuretics. More importantly, thiazide-like diuretics. Thiazide-like diuretics, they are antihypertensive and diuretic medications. They are mainly used in the management of hypertension. Uh, Usually, they are given in the third step of hypertension management. So, someone with a history of hypertension. So, diabetes was a risk factor for septic arthritis, and hypertension you can say is indirectly a risk factor for gout, because hypertensive patient may, sometimes they are taking these thiazide diuretics, which can lead to decreased excretion of uric acid and result in gout. Similarly, loop diuretics, so loop diuretics and thiazide diuretics, they both lead to decreased excretion of the uric acid and result in gout. So, in short, a risk factor for gout they include bendrofluorothiazide, furosemide, and excessive alcohol and meat consumption. The most commonly involved joint in septic arthritis was knee joint, while the most commonly involved joint in gouty arthritis is first metatarsophalangeal joint. Other joints can also be affected, such as ankle, wrist, and knee joints. But the most commonly joint that is involved is first metatarsophalangeal joint. The diagnosis is done by analysis of the synovial fluid. Synovial fluid will be sent for microscopy and not for culture and sensitivity. Microscopy will confirm the presence of monoreferent uric acid crystals. Remember that you will not pick serum uric acid for the investigation or to confirm the diagnosis of gout, because it is usually normal or low in the acute stage. So serum uric acid will not be the answer in exam. So if we are suspecting gouty arthritis, someone with a history of hypertension or heart failure, and he is on thiazide diuretics or loop diuretics, someone, a businessman with a high consumption of meat or alcohol, present to you with knee pain, swelling, without any history of fever, because it's not an infection, so fever, systemic signs and symptoms will not be present. You will suspect gouty arthritis. You will send synovial fluid for analysis, for microscopy, and in the microscope we can see the presence of monosodium urate crystals. Serum uric acid, it may also be raised, but it is usually not a definitive test because during acute attack it is usually normal or low. Because during acute attack, excessive uric acid is deposited in the joints, so that's why it may be low during an acute attack. The management of gouty arthritis, it include, if the patient presents with acute attack, then we will use NSAID as first line drug, ibuprofen, naproxen, and colchicine as second line drug. And for long term management, uh, 2 weeks after acute attack, allopurinol will be used to increase the excretion of the uric acid, and along with allopurinol, NSAIDs and colchicine coverage will also be given. Another drug is febuxostate along with allopurinol. Febuxostate, it decreases the synthesis of, it inhibits the enzyme that is involved in the production of uric acid, and allopurinol, it increases the secretion of uric acid in the kidneys. So the first line drug in gouty arthritis for long-term management of gouty arthritis is allopurinol, and the second line is febuxostate. In acute attack, first line is NSAIDs and second line is colchicine. So if both of them are given in the
Just repeat
option,
it again.
yes,
Can you repeat that point?
about allopurinol and febuxostate.
Yes.
So allopurinol, it increases the excretion of the uric acid, and febuxostate, it decreases the synthesis of the uric acid. It inhibits the enzyme that is involved in synthesis of the uric acid from nucleic acids. So for long-term management, allopurinol is first line and febuxostate is second line. And for acute management, NSAID is first line and colchicine is second line. So if both of them are given in the options, then you will select NSAID, such as ibuprofen or naproxen. But if they mention in the question that there is no improvement with the NSAIDs, then you can try colchicine. So, for example, a question is given: a hypertensive patient presents with a big toe and severe pain, swelling, and erythema. So, hypertension is a risk factor for gouty arthritis, and diabetes is a risk factor for septic arthritis. Because this hypertensive patient, it may have been taking loop diuretics for the management of, thiazide diuretics for the management of hypertension. Similarly, patient with heart failure, if he present to you with this kind of big toe with severe pain, then again your diagnosis will be gouty arthritis. And remember that the symptoms of heart failure can also be worsened by the use of NSAIDs. So this question can be asked in two ways. One is that a hypertensive medicine or heart failure patient present to you with joint pain. What is the cause? Your answer will be loop diuretics, and a patient who was diagnosed as a case of gouty arthritis. He has a history of heart failure, present to you with shortness of breath and dyspnea. What is the cause? Then the cause will be NSAIDs. So NSAIDs can worsen the symptoms of heart failure, and loop diuretic can worsen the symptoms of gouty arthritis. So it's a two-way traffic basically. Another example: a 54-year-old man on bendrofluorothiazide for his hypertension presents with painful red and swollen left index finger. See, other joints can also be involved. A hypertensive patient who is on thiazide diuretics present to us with a red and swollen little index finger. Your diagnosis is straight away gout or gouty arthritis. It happened spontaneously without a history of trauma. There is no fever. So it ruled out septic arthritis. There is no fever. The distal interphalangeal joint is red, swollen, warm. So the features, the localized features such as redness, swelling, and warmness, they are common to septic arthritis. But no fever means this is not a septic arthritis. He had an milder episode 5 years ago, and it was resolved on its own. Uh, he also has a previous history of such episodes. It means he had gout that gets got worse on the use of these medication. The investigation, the most appropriate investigation in acute tag is synovial fluid for microscopy.
Is it possible to do this synovial fluid microscopy from metatarsophalangeal joint? Because it's a very small joint.
Yes, the fluid can still be taken from this joint because there will be swelling. Swelling means excessive fluid is present due to
Right.
inflammation.
Oh, okay, okay, okay.
So yes, but usually the fluid in normal there will be no much, not that much fluid. But in arthritis, due to inflammation, because capillary permeability or the endothelial permeability, the epithelium lining permeability is increased, so there will be fluid accumulated in this joint space.
Thank you.
So yes, it's possible to do a aspirate in small joints as well. Now, our next topic is there is a comparison of gout and osteoarthritis is shown. Let's discuss osteoarthritis and then I will compare these. Osteoarthritis is discussed in orthopedics chapter, I guess. But in comparison to rheumatoid arthritis, remember that osteoarthritis is basically an age-related degeneration of the joint. And in osteoarthritis, the pain in joint gets worse with activity. While in rheumatoid arthritis, the pain improve. The pain is or the stiffness is more in the morning and it improves with activity. Furthermore, there are some X-ray differences between osteoarthritis and rheumatoid arthritis that we'll discuss in orthopedics chapter. So this was all about causes of monoarthritis such as septic arthritis and gouty arthritis. One cause is remaining, that is osteoarthritis, and that is age-related degeneration of the joint, most commonly knee joint. Other joints can also be affected. We'll do that in orthopedics chapter. For now, our next topic is rheumatic fever.